The following is an exclusive presentation of Cablevision local programming. TV that's close to home.
Attention deficit hyperactivity disorder, or ADHD, can affect kids and adults and may be related to sleep. We'll tell you all about ADHD on this week's Health Talk. We're coming up next. Dr. Andrea Peterson. Today on Health Talk, we're going to discuss ADHD. We're going to be talking about ADHD in children in this segment. We're with Dr. Vicki Smetak. She's the chair of the Department of Pediatrics at Norwalk Hospital. We're also joined by Dr. Lewis Cass. He's a pediatric pulmonologist and a sleep medicine expert. Welcome to you both to the show. Appreciate having you back.
Thanks for having me.
Thank you.
So, Vicki, in the last segment, we were talking a little bit about ADHD and diagnosis and kind of making the distinction between kind of symptoms and impairment. Could you elaborate on that a little bit in kids?
Sure. I think that's a really important distinction to make because as Dr. Michael pointed out earlier, you can have symptoms that don't necessarily all add up to an actual functional impairment. And by impairment, we mean that the child is unable to function in a certain environment, be it in multiple environments, actually, school and home, school and social situations, home and social situations. There have to be at least two areas in which the child is functionally impaired. And that's an important distinction to make because, again, a lot of children are what we call loosely hyperactive, but a child who's just happens to be very energetic but yet functions normally, does well in school, gets at least average grades if not better, and just happens to be more exuberant than most, doesn't necessarily fit, in fact probably doesn't fit the diagnosis of ADHD. There has to be a certain level of impairment.
And are there ways in which pediatricians and teachers and parents kind of tell the difference?
Sure, that's a very good question. There are actually screening tools when, so usually the red flag is raised by the teacher because kids spend the majority of their time in a classroom environment, which happens to be pretty structured, even starting in kindergarten, and that's why the diagnosis is typically made once children start school, where they have to perform and fit within certain standards. So the teacher usually raises the red flag. The parent will then work with the teacher and the pediatrician, and there are screening questionnaires that the teacher will fill out. The parents also fill out, and then that information is reviewed by the pediatrician or an appropriate specialist to see if there's cause to go any further.
How do you counsel parents when they come to pediatricians and they say, my child's teacher was a little worried about ADHD? How do pediatricians kind of start talking to parents about this?
In a very supportive fashion. I think it's very important to say a lot of what we do as pediatricians is supporting not just the child but the family as well. I mean, it's an important point to make that this is an ongoing chronic condition. Although some of them do go on to resolve and get better with age, there is a certain percentage that go on to have symptoms into adulthood. So it's not a diagnosis to be entered into or entertained loosely, if you will. So we start by talking to the parents about their concerns, if they've noticed any concerns, to sort of validate what the teachers are observing in school. And then if the parent starts to validate those and says, what, I've also noticed at home that we have trouble with these certain areas, then that does become more concerning, and then we help them through the process and go through a more formal evaluation.
So, Lewis, one of the really interesting things that's come about in the last several years, I think, is this thinking about the connection between sleep in kids and ADHD and hyperactivity. Can you tell us a bit about that?
Sure. It's phenomenal. It's fascinating. Probably about 10 years ago, they started wondering, and rightly so, what if a child didn't get any good sleep? And we as pulmonologists take care of a lot of kids with sleep apnea and trouble sleeping, restless sleeping, snoring, and somebody made the link between poor school performance symptoms of hyperactivity, impulsivity, and these sleep-related disorders.
And it makes some sense, right, Vicki? I mean, just as a parent, when my kids are sleepy, it's not like they always just conk out and take a nap or go to sleep. Often they're agitated and they're running around and they're not paying attention to what I'm trying to say to them.
Sure. And those are important connections to make, and also important distinctions to make, right? When is it ADHD? When is it something else that's maybe presenting itself that way, but is really an underlying sleep disorder?
Right. Or when is it both?
When is
a person hyperactive and things are exacerbated by a poor night's sleep?
So really, sleep experts started kind of looking at that and saying, you know, how can we define this connection?
Right. So the leading researchers in the field began doing sleep studies on these children, found that a lot of them had obstructive sleep apnea, recommended treatment for obstructive sleep apnea, and found that these children suddenly were no longer needing their stimulant medication any longer.
Amazing. Revolutionary.
Amazing. So simple. And in addition to not needing the medication any longer, they found that children accelerated in terms of their growth and development. School performance improved.
Does this mean that, you know, most children or all children in whom the diagnosis of ADHD is raised should have a sleep study or be screened, or are there other ways to kind of start teasing out whether there may be an underlying sleep problem?
I believe that there are three basic questions that a pediatrician could ask in the office to serve as a simple screen. Number one is, does your child snore? Is your child restless? Does your child sweat during sleep? Most children who don't have a sleep problem will sleep calmly and comfortably. There can always be a little bit of tossing and turning, but parents with tossers and turners will tell you that they circle the clock all night long, just twisting and turning and throwing the sheets off the bed. So snoring, sweating, restless sleeping.
That's very important. And Vicki, maybe you can tell us a little bit more about, in addition to sleep problems, some of the other things that pediatricians think about to say, well, is it really ADHD or is it something else?
Sure, that's a great question, and that's something that as pediatricians we're always looking at to make sure that we're making the correct diagnosis. For example, the first thing that comes to my mind is a type of seizure disorder, absence seizures, which can look very much like the inattentive part of ADHD, the attention part, where a child is often appears to be daydreaming or staring off into space. And so with this type of seizure disorder, these are brief, often multiple seizures where the child is just not connected to reality.
And they're not convulsions that most people associate with seizures. They're a different kind of seizure, so people just maybe not really responding for a period of time.
And so for a teacher in school, it may look as though that child is completely tuned out and not interested and not participating, but in fact they may have this particular type of epilepsy, which is not terribly uncommon. So that's an important thing to be looking at. And then other disorders more in the psychiatric realm, conduct disorders and other behavioral issues that can start off presenting as ADHD. One of the ways to tease out the difference over time, those children typically don't respond to stimulant medications when they're started on them. And some of those, there's a certain degree of comorbidity associated with ADHD, so you can have both together. You can have a child with ADHD that at the same time has a conduct disorder or has another bipolar disorder, for example, or some other mood disorder. And those children tend to do better on a different type of medication and not the stimulants.
That's a really important point, because we often try to think about medical disorders as being in isolation, but clearly more than one thing can happen in a particular child or adult kind of at the same time.
Sure.
Louis, how do you approach kids when they come, when they're referred to you for an evaluation of sleep problems and whether it's related to their hyperactivity?
Well, we go through a typical history and physical examination, trying to find out about whether a child has enough hours of sleep. Sometimes not having enough hours of sleep are going to make you feel unrested and hyperactive and impulsive during the day.
How many hours a night should kids get?
Good question. Many answers to that question, but depending on the age, roughly 10, 11 hours a night. Our teenagers should be getting 9 hours a night. You and I should be getting 8 1/4.
Yeah. Good luck. Right? No. How do you know when a child needs a sleep study?
I think that if a child is having a long-standing issue with sleep and it isn't resolved in an easy fashion, I think it's worth doing an overnight sleep study. The sleep study is a wonderful study. We put many non-painful electrodes on the head and face and neck and chest and arms, and you put enough leads on somebody for enough hours overnight, you find out what the story is.
What really is going on?
Are you snoring? Are you dreaming enough? Are you kicking your legs? Is your heart racing? Are there seizures? It tells you really everything about cardiopulmonary function and limb movement and brainwave activity.
Do parents stay with their kids when they have a sleep study, or?
All night long.
All night long. That's great. Vicki, maybe you can tell us a little bit more about treatment in terms of kids with ADHD. We heard a little bit in the last segment about how it may be important to combine medications with cognitive behavioral therapy. Does that work for kids too, or?
It certainly does, and medications are generally used when we're very confident of the diagnosis, because we know that they work and we know that the results are often almost immediate. However, there are behavior modification therapies that have yielded very positive results. However, in conjunction with medication therapy, all the data that I've seen, and I think that's available, shows that a combination approach is really the most effective. Behavioral modification in the sense of using, in the younger children, using a reward system. So, and there's also a system of what we call report cards. So there's a report card that has maybe 2 or 3 tasks that the child has to successfully get through over the course of the week. For example, not calling out in class. And so the teacher will check yes or no for each day of the week. And then get that information over to the parents. The parents will review that, and then the pediatrician ultimately gets all that data and puts it together to see if the medications are actually being effective, or behavior modification alone with a reward system at home, if that's effective in help with the disorder. But often it's with medication.
So kind of a multidisciplinary kind of approach. We have about 15 seconds left. Last kind of comment for parents about ADHD in their kids?
I think that it's important to just tell parents that it is very prevalent, but not to over jump into the diagnosis. To look at all the aspects, look at what's happening in school, look at what's happening at home, and look at the child as a whole, and not just focus on specific symptoms. I think that's probably some really good advice.
Important. And Louis, about kids and sleep?
I would just say don't blow off the restless sleep. If your kids are very restless, look into it.
Come and talk to your pediatrician and talk about whether to get a sleep study for your child.
Sure.
Really can make a big difference in
Huge
kids'
difference.
lives if you treat that underlying problem if it's there.
Yep.
Great. Thank you so much, both of you, for being on our show and giving us such great information about ADHD. We appreciate it very much. I'd like to thank all of our guests, Dr. Tait Michael, Dr. Vicki Smetak, and Dr. Louis Kass, for being on our show today and giving us such great information about ADHD. If you have a question you'd like to ask on a future Health Talk, please contact us at healthtalk@norwalkhealth.org. Thanks so much for watching, and we'll see you next week on Health Talk.